Welcome to the Green Table Talk. I am your host, Janine Johnson.
One unique thing about lupus is I think there's about 11 criteria, and that's how I was diagnosed with lupus.
And this is at 14. So tell me, what was going through your mind at this point? Because I know at 14, you probably had no idea what lupus was.
Sometimes, I know I'm gonna pay for something, but it's a once-in-a-lifetime thing, so I'm gonna do it. Our symptoms don't usually express themselves in a visible way, and I'm the type of person who, if I spoke about my symptoms every time I had them, I wouldn't stop talking.
Welcome to the Green Table Talk. I am your host, Janine Johnson. Today, we're sitting here with my friend, Jalesa. Jalesa is going to share her amazing journey and her story with lupus and various other things that takes place in Jalesa's life. We're going to discuss the ups and downs of her health situations, and we're going to touch upon a lot of interesting topics here. But first, let me introduce you to Jalesa. Jalesa, welcome to the show.
Thank you for having me. I'm excited to share my story.
Of course, I'm glad you're here. I'm glad you can be here with us and let us know a little about your journey. Before we start, let our viewers know a little bit more about you. Let us know about Jalesa, any hobbies, things that you really enjoy doing. Let us know about Jalesa.
Yeah, so my name is Jalesa. I'm a 26-year-old master's student. I'm currently studying health sciences. Some of my hobbies include writing poetry, reading books. I like to do different devotionals and Bible studies, and I also play piano and guitar.
Beautiful, beautiful. What's your favorite song to play on the guitar and the piano?
Ooh, I would say on the guitar, there's a medley that my dad and I have always sung together. We've been doing it for almost a decade. So it's just
Mm,
a medley of different reggae songs, Barris Hammond, Taurus Riley, Sanchez. So I love being able to sing that medley with him and play guitar.
nice. That's very nice. So let's start with your journey. So as I've just mentioned, you have lupus. When were you diagnosed with lupus?
So I was diagnosed at 14, but I was experiencing symptoms about a year before that.
Okay, so tell us more about us. Tell us more about that. So your symptoms. Did you just one day wake up one morning and you felt, you have stiff joints, or like what happened there?
Yeah, so the first symptom I had was swollen lymph nodes. So it was kind of just like a lump on my neck, no really other symptoms. Went to the doctor, he didn't really know what it was, and he was kind of just waiting it out.
Mm,
And then another symptom I had was hair thinning. And then I also had a bit of muscle and joint pain upon exertion. So those are my main symptoms. And then I eventually got sent to Sick Kids Hospital to oncology because the symptoms all pointed towards cancer, including my blood work.
mm,
But after months and months of tests, no cancer tests were coming back positive. So they sent me to rheumatology. They did all the testing. One unique thing about lupus is I think there's about 11 criteria, and I think you have to meet at least five or six of them to be officially diagnosed with lupus. There isn't just one blood test, it's a combination of criteria. So I met those criteria, and that's how I was diagnosed with lupus.
and this is at 14.
Yep.
Wow. So tell me, what was going through your mind at this point? Because I know at 14, you probably had no idea what lupus was.
Yeah, no idea what it was. They explained it to me as an autoimmune disease, so that means that the immune system is attacking the body as opposed to attacking, viruses and other things outside of the body. But I don't think I had a deep and true understanding of what that would look like and the impact on my life.
Hmm.
I immediately got put on a drug called prednisone, and that had a lot of symptoms associated with it, including weight gain, stomach pain, bone pain. But in terms of what was going on in my mind, I kind of was just taking it as it came, whether it be new symptoms or things like that. I was just in a lot of communication with my doctors and just learning as the time went on.
And how did that affect you at 14? You're taking prednisone, which I know is a very difficult drug to take. Sometimes it's very hard to tolerate. So at 14, you're in high school at this point in time. Like how was that, taking this medication and going through the symptoms at the same time? Did it affect your, childhood at that point? Like your life in high school? How did that affect you?
I did miss a lot of school, like, cause I got diagnosed like at the end of September, so I did miss like quite a bit of school. Had conversations with like all of my teachers and my parents, and letters went out and stuff like that. For me, I think I tried to like not think of it long term, because I think if I was thinking like 10 years, 5 years, I think it would have consumed me as like a 14-year-old.
Hmm.
So I was mainly dealing with weight gain, which was just frustrating, like dealing with stretch marks and like having to get new clothing because my body was like getting bigger. So that was like hard to deal with. And then mostly like the stomach pain and the bone pain was really difficult for me.
Hmm.
Just, having this normal process that we go through every day, which is eating, be disrupted by, reflux and nausea. I just wasn't used to it. So I had to change like what I ate and when I ate. But then with the prednisone, you crave like very unhealthy, salty foods. So in the beginning, I would eat those, but then it was about like combating that as well. And then the bone pain, I just like didn't know what to do. I'd be in bed, unable to move. And they, at that point, in September, they didn't really have an answer. And then a couple months later, I was hospitalized because I wasn't able to bear weight. And then I got an MRI done. And then that's when I was diagnosed with a vascular necrosis of the knee, which is another form for lack of blood flow causing bone death.
Wow, bone death. So what do we do to, at this point, what are they doing to combat this? You're dealing with lupus and now you're dealing with this. You just found out that this situation is taking place. How are you navigating both? How are they taking care of both situations now?
So the main focus for them was the bone death. Fortunately, the medication that I was put on was strong enough to control the lupus. So on the lupus front, things were looking good. In terms of the bone death, they said, we don't think this is going to progress quickly. We think, the only solution is a knee replacement. So we think you're going to need a knee replacement like in your early 20s. But in the meantime, all we could do is treat it with pain medication. And eventually they sent me to like a chronic pain clinic that specializes in pain. So I was seeing a psychologist, I was doing physiotherapy, I was doing acupuncture at one point, and then also being given medication. So at that point, it was just we're going to manage the pain until you can't manage the pain anymore. And that point came around grade 11 where I was hospitalized again, and it was decided that I needed to get the surgery because the bone was dead, there was no cartilage, and it had just gone to the point where it was time for the surgery.
So this is knee replacement surgery you're talking about.
Yep, correct,
Wow.
yeah.
And how old were you at this time?
So the first one I was 16, and then I had the second one 4 months later at
So
17.
two knee replacement surgery before the age of 20 is what you're saying.
Yeah.
Wow. So how did you deal with that? Like, so, and it's just 4 months apart. Like, not even like 6 months, a year, 4 months apart. So you're still
Mm-hmm.
recovering from the first knee replacement surgery, and you went in and did the other one 4 months later. How are you
For
dealing with
sure.
this?
Yeah, so fortunately, I had a great physiotherapist who was able to prepare me to the best of her ability by giving me exercises that could strengthen my muscles to prepare for back-to-back knee surgeries. Um, I would say the thing that helped me, it was a traumatic experience for sure. Like,
Of course.
it really got to me subconsciously. Like, I think 3 or 4 days before the surgery, I couldn't keep food down. Like, I was eating like apples, crackers, rice. I was just so nauseous. Because it was my big, like my first major surgery,
Mm.
and I didn't really know what the outcome would be, but it was managed pretty well. Like the pain wasn't too crazy. The nursing staff was nice, and the thing that I would say has helped me the most was being able to go to Toronto rehab. So it's kind of like a step in between the hospital and home that prepares you to be more independent when you go home. So it helps you with like walking around, cooking meals, getting in and out of bed, getting in and out of the shower, stuff like that. So that I would say was helped me a lot physically. And then with school, my school was really understanding. Like at that point I was in grade 12, so I had had like a good relationship with most of my teachers. So they were able to help me out. They were able to get me like tests and everything that I needed. They even excused me from a couple exams, and I was actually able to have teachers come in for every subject to my house to actually help me like with school and tutoring and stuff and to monitor the exam. So school was super supportive in just helping me, and like an occupational therapist came to my school, a physiotherapist came to my school. So the supports in place were very helpful and helped to ease the stress in almost every way other than like the pain, but yeah,
Hmm.
it was really.
That's amazing. That's a great support system from the school. And let everybody know what exactly you're doing right now in terms of schooling.
Yeah, so I'm currently doing my master's in health and rehabilitation sciences at Western University. I'm in the field of health promotion, and I'm looking at diversifying primary care health teams.
I love that. I love that. If I could just put like an emoji on the screen with like hearts coming up on the screen, I would do that. The reason why that makes me so happy is because regardless of what you went through, and yes, everybody was accommodating in school and what have you, you still stuck to it. And you're like going through it, regardless of the pain, regardless of what have you still stuck through it. And look where you're at now, which is amazing. People, listen, there's no excuse. There is no excuse because there are some people out there fully healthy and strong, and they're just blowing away their education or just blowing away the opportunity to learn and develop and grow. And here you are, double knee replacement surgery, health issues, what have, and you're going hard, which is amazing. So I love that. I had to put that out there. I love that. So back to the health situations now. So you've had double knee replacement surgery. Life is difficult in terms of pain and etc. Let's talk about the surgery itself. Let's talk about the hip replacement surgery and everything else that came thereafter. I know it seems like things were good, things were going along smoothly until you were thrown another wrench. What happened there?
Yeah, so after I graduated high school, things were pretty like quote unquote normal. I did have like some mini flare-ups, but I was able to adjust my medications and deal with that. And then a year into starting my master's, I was at home and I tripped on like a puddle of water. There like wasn't really any symptoms immediately, but a month later, I had like really bad hip pain, thigh pain, was had to walk with a cane, then I had to walk with a walker, then like I wasn't able to walk. I went to the doctor, got an x-ray, didn't show anything. And my physiotherapist eventually said like I think you should go to the hospital because it could be a fracture or something like that. So I ended up going to the ER. The x-ray weirdly enough didn't show anything, but they did a CT and that showed a fracture. So they said,
Mhm.
"Okay, it's fractured," which I kind of expected. Like I was doing, my own little research online and like looking up the symptoms, and just certain things were pointing towards that. So they said, we have to do a surgery, we have to put a rod in your leg. And that was like a couple days before my 23rd birthday. So I did
Mhm.
have to spend my 23rd birthday in the hospital, recovering from that and then going to rehab again.
Wow.
And then about 3 or 4 months later, I don't really know how this fracture came about. I don't know if it was just like stress from putting weight on the other leg, but there was a fracture discovered in my right hip. So I had to do surgery for that at a different
Mm.
hospital. So that was also a process of like going to rehab, the left hip not being fully recovered and having to navigate that. Also have like having been on painkillers from the first hip fracture and trying to come off of it, but then having to go back up because obviously surgery pain is really bad pain. So I had spent about a year recovering from that, and things were looking good, and I was able to drive longer distances and walk longer distances and do activities that I had been able to do before the fractures. And I was up north somewhere at a retreat, walking outside, slipped on some wet snow, fractured this time my femur. So
Oh
this
my
was my
gosh.
third fracture in about 3 years. Yeah, so that was just a whole other process. And my femur is still not fully healed. So I'm going through some treatment to try and get it healed. And if it doesn't heal, I'll have to get a hip replacement. So
Oh
it's
my
just been back
goodness.
to back to back fracture, unfortunately.
Wow. What's your support system like? Because this is a lot for one person to go through. So, what's your support system like in terms of family, friends? Like, there's someone that you can turn to if you just like want to scream and say, "What is going on?" Is there someone you can turn to that's, just to cry or just to anything? What's your support system? Tell me about your support system.
Yeah, so my family's been supportive. Every single time I've had a fracture, it's been in Toronto, so it's been like a 40-minute to hour drive for them to come see me, but they've always like made it a mission to come see me, even during COVID, because being in the hospital is hard, and then being in
Hmm.
the hospital alone is difficult. So it was nice to have that familiarity. They'd bring me like food from home, because anyone who's been in the hospital probably knows hospital food is horrible.
It does
So
suck,
that was
yes.
always nice, getting food and snacks from home and just being supportive, very much physically. When I fractured my hip, I wasn't able to go up and down the stairs for about 6 weeks. So I
Hmm.
was like stuck in my room. So my parents had to like bring me up every meal, anything I needed from downstairs. So it was a lot on them and my siblings physically just helping me with like the most basic tasks, but they were very supportive and willing to do that. So I'm grateful for that because I know some people don't have that support
Hmm.
when they go home.
Yeah.
And then in terms of friends, I do have like some friends who have dealt with chronic pain, not like to the extent that I have or like the fractures,
Hmm.
but they know what it's like to live with chronic pain and the nuances that come with that. So um, I've been able to speak to them about that. And then also I would just say my faith and just reading what the Bible has to say about suffering and reading like a couple books on suffering and just trying to have that eternal perspective, I would say.
Hmm. Wow. So, tell me more. Let's talk about more about your faith. Do you feel that this is just one big test that God is putting you through? Do you feel, you know, this is happening because in the end you're going to be able to share your story? Like, tell me more about your faith. Why do you think this is happening right now to you, or has been happening to you?
I think it's a combination of things. I think that my faith is the strongest. Like initially, if I'm not feeling well, a lot of times I like don't even pick up my Bible because I'm just not feeling well enough to do it. But
Hmm.
then there reaches a point where I do. So I feel like I kind of need, it sounds kind of weird, but I feel like I sort of need to be facing a trial to be the strongest that I can be in my faith because of the need to rely on God. And there's that verse that talks about like our his strength being perfected in our weakness.
Hmm.
And there's another verse that talks about, it's kind of like weird phrasing, but it basically says that our strongest as humans is God's weakest, and
Because,
our
yep,
wisest as humans is like God's like dumbest, even though obviously God's not dumb, but like that's the way it
exactly.
explains it.
Nope, but I understand.
Just
Yes.
like our limited power as humans. So I feel like that's one aspect. Another aspect I think, like you mentioned, to be able to help people through it. Um, just like there's a verse that Paul says where he said he dealt with suffering and he said, if the only reason that I'm going through this is to help other people, then it will be worth it. So I feel like that's kind of a part of it too. And that's kind of something I've come to accept. And then also, I think to help me like not take things for granted, to also be that testimony to people around me, like things that people see as normal things I can't do, like getting up and going somewhere, or waking up not feeling nauseous, or having a medication schedule control your life, like things like that, um, have just given me perspective, and I would say like an eternal perspective of reading the Bible and what it has to say about suffering, and just the concept of like our suffering now being incomparable to eternal glory, and God working all things together for good, and knowing that there's like an absolutely incomparable weight of glory that's waiting for us, so we can focus on the future and not now. And those are kind of the verses that I have in my head when like I'm in excruciating pain or I'm so nauseous I can't even think. It's just the one thing that I keep saying because it's something that, the enemy can't take away from you because it's the word of God. So I try and focus on those, but sometimes it's hard because when you hear the words incomparable and can't compare, you're like, okay, what is it then? Right?
Mm-hmm.
Because like if the thing that you can think of, like the thing that I think of is no pain, no nausea, no this, no that, right? But that's comparable because
Yes.
we can imagine that. So what does incomparable even look like? It's hard to hope in something like that, but
Mm-hmm.
I try and I try and focus like that. And the last thing I do want to say is people talk about like eternity is so hard to fathom as humans. Like I've heard it described as like a pinpoint. If you like went around the earth a whole bunch of times, it would just be like a pinpoint in time. So it's also hard to conceptualize eternity, but knowing that like the Bible says eternity has all of these things kind of keeps me going, I would say. Sorry, that was really long, but I wanted
No,
to make
that
sure
is
I got everything.
perfect. That is perfect. You hit the nail right on the head, Jalesa, with that one. Right on the head. I truly believe that this is not a punishment, first of all, because I've heard that before in terms of my situation. It's not a punishment. God will bring you to it and through it, right? So, whatever it is that you're experiencing right now, or whatever it is that you have been experiencing, it's your journey. This is your path. And he's not going to bring you halfway and then just walk away. You know what I mean? He'll bring you to it and through it. So what you said is 1,000,000% correct. And I also agree, which I also say as well, everything that we're going through, everything that I've gone through health wise, everything that you're going through right now, if this is something that we can use to educate and show others, this is how we've dealt with it, this is how we can deal with it. Look at me, I'm standing strong, I'm here. I'm not perfect, but I'm here and I'm still standing strong. It's all worth it. You know what I mean? It's all worth it because we've been to it and through it. And now we can actually share the story with others. So what you said, perfect. Hit the nail right on the head on that one. You've touched upon, your what a good day would be like. Not nauseous, no nausea, be able to eat properly. Like, let's talk a little bit more about that. Like, are you able to go to the movie theaters and with your friends and sit in a 2 hour long movie? Are you able to, I don't know, go to a party, a house party somewhere and dance and have fun and like what's a good day like for you? And are you able to do those things that everybody else would be able to do effortlessly?
Yeah, I do want to emphasize that a good day has looked really different for me. I would say like pre-fracture and post-fracture. I sometimes think about the things that I like used to be able to do pre-fracture. And in my mind back then, it was limited, but comparing it to now, it's not. So, an example is I went to school in London. So, what I used to do is I would have to take a train to Toronto, and then there's a train from Union Station to the airport. So I'd have to walk like this long distance to get to that train. And then once I got to the airport, I'd have to walk a long distance to the airport to get to where whoever the person was picking me up was. So that to me was a long distance, but it's something that like I physically can't do now because of my limitations with my fractures. So I like to see it as like good days back then and good days now.
Mhm.
For me, in terms of like things like going to the movies or driving a long distance, it really just sometimes there's like things that I can identify to say, okay, because of this, I'll be able to do this. or because of this I won't be able to do this, but sometimes it's so random. So for example, for the past probably 2 years, I've been going to the movies pretty often because I have like a movie pass. And it's been fine. I would go drive like sometimes 15 to 30 minutes, sit in a 2 to 3 hour movie, be fine. Like my week could go on as normal. And then one time I did it at the end of last year. I didn't have my walker, which I've learned does make a difference using the
Mm.
walker versus the cane. And for the next week, I was like practically bedridden. Like I was hopping around on one leg. I could barely go up and down the stairs. I even missed a New Year's party with my family. And it was just so random, and that is what led me to like get more testing, and I eventually found out my femur is not healed. So that all made sense. But yeah, so sometimes I could do those things, sometimes I can't. Sometimes like I know I'm gonna pay for something, but it's a once in a lifetime thing, so I'm gonna do it. Like 7 months after I fractured my femur, one of my best friends was getting married 3 hours away, and I'm like, I'm gonna do what it takes to be able to drive there, and it worked out. But sometimes it doesn't work out and I do have to pay for it. Mind you, at that wedding I did not do any dancing because I'm like, I'm probably gonna have to pay for it if I do.
You'll know in the end,
Um,
yeah.
yeah, for sure. So for me, back to like your original question, I would say a good day would be like restful sleep because I find that sometimes I like wake up and just feel like I haven't gotten into that stage of like deep sleep. I would say waking up with no nausea because that's something that I always wake up with is like nausea and hunger.
Mm.
Um, I would say being able to do like maybe like multiple activities and not get tired. So usually I can designate like one major activity to a day. So like a doctor's appointment, a movie, going out to dinner, hanging out with someone. Like I would love to be able to pack multiple things into one day just to be able to like do multiple things, if that makes sense, just for like the
Mhm.
fun of it. Like hang out with a friend, go out to dinner, go see a movie, go to a party, whatever, even though I'm not really a party person. But anyway,
But
so
still,
that would kind of be
if
my,
that
yeah,
opportunity was there, you'd like to take it, right?
for sure, yeah. So I
Hmm.
would say that's kind of thinking of my symptoms, and also just with chronic illness, you have to just be so mindful of like what you do and how it's going to impact your future. So to
Mm.
not have that like pressure of being like, okay, I can't walk to this store because then this is going to happen, or I have to take this medication at this certain time. Even like planning appointments, like I have to be weary of the time of if I'm going to physio, when am I taking my painkiller so that it kicks in with enough relief so that I can get through that. So just like that constant thinking process of medication and symptom management and like not having to deal with that. I mean, now it's become the norm for me. It's been more than
Yes.
10 years, but just not having to constantly be thinking of how what I do in the present is going to impact my immediate future. And the last thing I did want to mention is that's especially present when I was working, which I'm on sick leave now, but also with my master's, because I'll plan to have something done this day, wake up nauseous, throwing up, whatever, and then not be able to do it. So I have to like plan far in advance, and then there's also the conflict of if I feel well I don't want to work on it. So just like so many conflicting things to think about.
Hmm. Wow, that's a lot. That's a lot. Like I said, you're a strong person. You're a very strong person to be able to navigate and to endure all of this. Do you feel that you've missed out on anything in life? Like, do you feel that I don't know if attended your high school graduation, or did you, I don't know, anything. I know you mentioned you went to the wedding and you said, you know what, come hell or high water, I'm going to that wedding, so you did that. But do you feel like you missed out on certain things, vacations that you couldn't do with the family or anything?
One thing I did want to mention before I answer this question is, you do mention, I'm a strong person dealing with it, and even like my sister at one point was like, I don't know how you do it. Like, if it was me, I wouldn't be able to. But I think people don't give themselves enough credit. One thing I learned is that like the world keeps moving, it doesn't stop for you, and nobody was stopping for me. Like obviously I had high school accommodations and stuff, but it's not like my parents were like, okay, Jaleesa, like you could take time off school to adjust to this, or you I just never wanted to stop. So I feel like that's kind of part of what makes me strong is just like trying to find a way to keep going even though it is a lot because learn how to do stuff and you just take it as it comes and yeah. So I
And what's
did
the
want
other
to mention
option
that.
too, right? What's the other option? If we don't keep
Yeah,
going, if you don't keep going, then what? Like you said, life still keeps
exactly.
going, life still keeps moving. So I say we because I was in something similar, not as, in depth as yours, but as I said, I have lupus. But you have to keep going, right? You still have to, yes, you have your up and your downs, you have your good days and your bad days, but in the end, you have to keep going. And I think that's what makes you strong. It's the fact that you've decided, you know what? No, not today. I'm gonna do this. I'm gonna go. Even though,
Mm-hmm.
like for me, my joints was all achy and it hurts to walk, and it did hurt to walk. And mine is, my lupus is, quiet now, as I like to say. It's sleeping now. But there's those moments with those flare-ups, and it's like, oh my goodness, But we have to get up, dust ourselves off, and keep going. And I think that's where the strength come from, like what you were saying. Because what's the other options, right? Nobody's stopping
Yeah,
for you, so.
it's important to note too that when people see us, that is a day we've decided to keep going. If you don't see us, that could be a day where you just decided not to. So, yeah.
100%. 100%. So,
All right, back to
yes.
your question. Have I
Hmm.
missed out on things? Um, I was able to go to my high school graduation, prom, my undergrad graduation, which was nice. I didn't
Excellent.
really dance a ton at prom, just like pain management. I unfortunately did miss a trip with my family after the femur fracture because it just wasn't feasible for me to go. Um, like they were going to a resort. It wasn't feasible with my
Hmm.
injury. That's probably like the main thing. And then sometimes like friends events. So like I still have a lot of friends in London. So if they have a party and like I can't drive and there's just a lot of planning, as I mentioned before, that goes into things. So sometimes like if I have to risk it and be like, okay, I could book this train ticket and possibly flare up and waste $40 and not be able to go, or I can go but like not feel well. And my friends are super accommodating, but like if it's their birthday, I don't want them to have to be thinking about that,
Mm.
in that scenario. So, sometimes I'll miss little things, but I try and be there for the big things, or even if it's just like going out to dinner with my family, just like little things like that if I'm not feeling well.
Hmm.
But I do try and make it to like there was a family reunion. Um, I think it was 4 months after my second hip surgery and I did go to that because like it was a family reunion and it was difficult, but I did. So it kind of just depends on various factors.
Hmm. Okay. Okay. Well, I'm glad you were able to join or take part in most of the milestone events because last thing you want is to miss out on this stuff because it's bothersome. Everybody wants to go to their prom, everybody wants to go to their graduation, right? So I'm glad you're able to take part in those things. What would you say are myths that you'd like to dispel about your situation? Because I know with me, I heard a lot of, "Oh, you look good. You look great. You can't be sick. You can't be sick. You're good. You're fine. Are you sure you have lupus? Are you sure you had a transplant? You look great." So, and meanwhile, I felt like shit, right? So, what are some myths that you'd like to dispel about your health situation, um, and how you feel, or just anything you'd like to dispel?
Yeah, I don't so much get that you look good, you must be feeling like I don't get that you look good, you're not sick, but I do get that you look good, you must be feeling good. Because
Mm.
our symptoms don't usually express themselves in a visible way. And I'm the type of person who, like, if I spoke about my symptoms every time I had them, I wouldn't stop talking. So I usually don't talk about my symptoms unless it's really bad. So, like,
Hmm.
the way that my family can kind of tell is if I'm like, can you, like, warm up this dinner for me? Or can you bring this downstairs for me? Or can you, like, if I
You're
ask
more
them to do, like, a
dependent.
task,
Yeah,
yeah,
you're more
then they'll be
dependent on
like,
them.
okay, that's how I know it's bad because you can't do this for yourself, or at least like you're
Yeah.
not trying to hide your pain or stuff like that. So I would say, yeah, that's one myth. How you look is not necessarily how you feel. I know like this is probably more said with arthritis, and you can have arthritis with lupus, and sometimes it is different than like the regular arthritis, but just the like you're too young to be sick,
Mm,
or like young people don't get sick. I like for a while now have been dealing with hot flashes, and like for the longest time people didn't believe like I was actually having them because
because you're too
I guess
young.
they're associated with being old. I'm like, it's a
Mm-hmm.
real hot flash, like I don't know what else to tell you. So even like knee replacements are associated with older people. And
Yes.
yeah, I feel like the myths are not as present in healthcare, because like people just read my file and they're like, if it happened, it happened, right? But I think it's more so with people who don't have that experience with healthcare, they'll kind of assume like one thing or the other. I think some people also like feel like taking medication is a choice, which like in a
Mm,
lot of cases it isn't, or they'll be like, if I was you, I would have like gone natural, or like I wouldn't let them give me all those meds, but it's like they if I stopped them, they probably wouldn't do anything right away, but it's more
eventually.
like quality of life. Like I take
Mm-hmm.
my nausea meds because otherwise I'm gonna be too nauseous to do anything. I take my pain meds because otherwise I'm gonna be in too much pain to do anything. Like a lot of them
Mm,
are like for comfortability, and yes, they're probably I've been taking them from such a young age that there haven't even um, been a lot of studies on the long-term impact of the drugs that I'm taking, but I can't even think about that right now because it's either I stop it now and I'm just so uncomfortable trying to protect my future, or I just take them now and whatever happens, happens.
mm-hmm.
So it's kind of like those type of decisions, but a lot of times like we don't want to be on all the medications. It's either there to like save our lives or to make us be able to function in a somewhat normal way.
Yep. Agreed. 100% agreed. I agree, especially with the, you deal with the situation now or just look at the future. Because if you don't take it now, and I heard that a lot too. Oh, you should just go natural. You just take these natural this and natural that. And that's true. And that's great for some people. But for me personally, this is what I need to take. This is the concoction of medications I need for my life, for my situation. And yes, like you said, there's a lot of these medications that they don't have a lot of studies. We are going to be the study, the case studies as time goes on. But hopefully, and I keep the faith that when, hopefully it doesn't, but if and when that situation does come about, they'll have something. They'll have something to counteract or fix it or something along the line. So I can't be bothered to sit there and stress about the future and what could happen if I stay on prednisone for too long or my Fortic for too long or oh my gosh, these drugs are helping me and these drugs are saving my life right now. So I can't, you know what I mean? So I agree 100% with what you're saying. If you're not in
Yeah,
the situation, it's hard to really speak about it, right?
yeah, and I also like assuming what I would think in the future, I wouldn't be mad at myself for choosing to like live my life to the best of my ability, as
Not at
opposed
all.
to just, being home not feeling well and stuff like
Mm-hmm.
that. So,
Not at all. Not at all. What I'd like to find out from you is if you can tell us, you mentioned before that you've recite a lot of these Bible verses. And before when we spoke, you did say some of them, and they were just so touching. If you can recite some of the Bible verses or a couple of the Bible verses that you say to yourself to help get you through just a bad day.
yeah, so the first one is Romans 8:18. I love the book of Romans. I feel like it really just covers a lot of hard-hitting topics and it has a great perspective on suffering. So Romans 8:18 is your present suffering can in no way compare to your future glory.
Mm,
And then we have Romans 8:28, which a lot of people know. For we know that God works all things together for the good of those that he loves and calls according to his purpose. Even if we can't see or understand that purpose, it still gets me through sometimes. And then there's also, I don't know where this verse is in the Bible, but Paul mentions that if the purpose of my suffering is to help people, then it would be worth it. Also, God's strength is perfected in our weakness. And then there's another one in James. and it says, I think it's James 1 2 to 4 that says, "Count it all joy, my brothers and sisters, when you face trials of various kinds, for you know that those trials will result in the perfecting of your faith. And what is it? I'm trying to remember. I'm blanking right now. I'm just going to summarize it. Basically, it talks about the more trials you face, it will make you become mature, and then
Hmm.
that way you'll be complete and lack nothing, just in terms of life in general. And then the
Beautiful.
last one is 2 Corinthians 4:16 to 18, which says, "Do not be discouraged, although your outer body is wasting away, your inner body is being renewed day by day. For this light and momentary affliction is preparing for you an absolutely incomparable weight of glory. So we do not focus on what is seen, but on what is unseen, for what is seen is temporary, but what is unseen is eternal."
Beautiful. Oh my goodness. You mentioned some earlier, and I said, you know what, we have to get some more of that. That was just, thank you for blessing us with that. I love that. Thank you very much. Greatly appreciated. Let's talk about the walk. You have a walk coming up. Let's talk about that, the Lupus Walk.
Yeah, so a couple months after I was diagnosed, I think it was my aunt who found out that Lupus Ontario, which is the provincial fundraising and awareness organization in Ontario for lupus, puts on walks in like different cities throughout the summer. So it's a good opportunity to like raise awareness about lupus, meet other people and families with lupus, and just get some like good exercise in. So I'd been to about, I think, three or four of them, and there hasn't been one in Brampton for a while. So I decided that I wanted to coordinate a walk. So the walk is kind of two parts. So there's like an online portion, so you can create like a team page, which I have a team page, and I'll get Jenny to share the link to that. But it just kind of shares my lupus story in summary, and you can donate to that page for fundraising. So we raise money for different supports for patients. And then there's also a research fellowship that the Lupus Ontario grants organization grants every year. So part of the money goes to that as well. And then there's the in-person part of the walk. So that's like going to a place. So this year it's going to be Gage Park. We'll have some walking. We'll also have a raffle going on. We'll have some snacks for everybody. People on my team were selling t-shirts if you're interested in that, and everyone will get at least one piece of Lupus Ontario merchandise. So that's kind of what we're planning to do. So the walk is taking place um, on, I just want to confirm that.
While you're looking that up, that is a very good cause. And we will definitely put the link up in this episode. And if this episode doesn't air in time of the walk, you can still go ahead and donate to the cause. So the walk, you don't have to,
Yeah.
join the walk. You can still donate and
Mhm.
help, help out with, finding some type of cure or something that would take care of lupus for us and everybody else out there. There's millions of people with lupus. So this is a very good cause.
For sure. Yeah, so the walk is on June 8th. Registration starts at 10 a.m. and the walk step off time is 11 a.m. And yeah, it's just to raise awareness. You could still donate up until September, I believe. So it's throughout the entire summer that they're accepting donations. And yeah, we're getting there. There's a new therapy that was discovered. I won't go too much into it. It's a bit complicated. It involves extracting the blood cells of people with lupus, kind of going in and changing the DNA, and then
Mm.
re-injecting those blood cells back into people with lupus. And they're doing testing right now. It's looking really positive. So even to be able to bring that over to Canada, get some testing done with that and see where that goes, I think is a very kind of tangible solution we're beginning to see so far. So yeah.
That's good. I've never heard about that. Where is that? Where is that taking place? Like, is it in the States or?
So, I believe right now it's being done in the States. The Lupus Foundation of America actually did like a webinar on it, and they had a patient who actually underwent the procedure as a part of a trial, and she's had like no lupus symptoms for a very long time. She's been able to exercise more, eat healthier, but it was just a trial. So they're
Mhm.
still doing more trials before they can bring it out to the public, and it is like a very expensive process because it has to do with like your own blood cells and stuff like that. But yeah, so it's starting in America, which is usually how most things work. And
Hmm.
then hopefully it'll make it to Canada in terms
Wow.
of testing. Yeah.
That's great. That's good news. I wasn't aware of that. Thank you for sharing that with us. Well,
Yeah, no
I want to
problem.
say thank you very much for joining us. Thank you for sharing your story with us. I'm happy you were able to make it. I know you're not feeling well today, but I'm glad you still joined anyways. I really appreciate that. And I think that what you've just done and sharing your story with everyone here that's watching, you're definitely making a difference, especially with the Lupus Walk. Donate, donate, donate. Even if you don't make the walk, you can still donate and make a difference. At this point in time, this is where I do my nugget of knowledge. So this is where I present a quote to you or something that I feel represents you. And the nugget of knowledge today is from author Steve Maraboli. Life doesn't get easier or more forgiving. We get stronger and more resilient. And so I saw this quote and I thought of you automatically because you're very resilient, you're very strong. You roll with the punches, you do what you need to do to make it through the day. You have your ups or downs and you just do you. You take care of you, you do what you need to do, and you're unapologetic about it. And this is what I love. I just love this about you. And I love the fact that you took the time to share your story and let us know more about Jalesa and the walk and what you do. And congratulations on your schooling once again. That's to me, that's so big. That is huge. So congratulations on that as well. Continued success and achievements and hold your head high. Stay beautiful and do you. Thank you.
Thank you so much. I really do appreciate that quote. I think, especially with my first surgery, I was like, this is the hardest thing I faced in my life. And it just keeps getting harder, and I'm able
Yep.
to make it through. So thank you for that, for sharing that.
You're welcome. You're very inspirational. So thank you. And thank you, everybody, for joining us today on the Green Table Talk. See you again next time. Take care. Bye bye.